Parathyroid hormone is a major controller of blood calcium levels. Initial management of hyperparathyroid crisis involves correcting plasma calcium levels to safe limits. Calcitonin secretion is a counter mechanism to parathyroid hormone. There are 4 ways to lower calcium levels: lowering intestinal absorption, decreasing bone resorption, increasing urinary excretion of calcium, and excessive hypercalcemia. Dialysis may be necessary to restore normal levels. High levels of plasma calcium can be addressed in several ways. Fluid management with IV saline 3 to 4 liters to correct dehydration and stimulate the kidneys to excrete calcium is often the first-line management. In a hydrated patient, IV furosemide can be given as this increases urine production and assists the kidneys to excrete excess calcium. Just careful not to fluid overload. Biphosphonates will lower serum calcium levels further by preventing calcium from being reabsorbed from the bone. If calcium levels are extremely high, further medical management may be required with biphosphonates, such as pamidronate, to reduce the calcium level further and reduce bone turnover, which will improve bone mineral density. Hypoparathyroidism. Acute hypocalcemia would be tingling of the fingers, Shafostic and Trousseau's. Chronic hypocalcemia, fatigue, weakness, personality changes, loss of tooth enamel, dry, scaly skin, cardiac arrhythmias. For tetany, it would depend on the number of parathyroid glands that are removed, because first you would see tingling in the toes and fingers. Second, Shafostic sign by tapping the facial muscles. And third, the Trousseau sign, which is a carpal pedal spasm with occlusion of circulation with the blood pressure cuff. Management with mild hypocalcemia, temporarily reduced by having the patient breathe into a paper bag, which will raise the PaCO2 and create a more acidic pH. Oral calcium supplements take time and are used to maintain the serum calcium in normal range and prevent complications of hypocalcemia. A quicker replacement is calcium gluconate IV.